education slot. And this morning we are going to be having a closer look at an article by Shenghavi Loganathan, and it's an article that talks a lot about menstrual hygiene management. And as we know that a period is when a woman bleeds from her vagina for a few days. Although there are many myths surrounding periods, if managed correctly, they are very normal and a sign that you are healthy. They start at puberty when girls are aged between 10 to 14 and happen once a month. They last between 3 to 8 days and are heaviest on the first 2 days. And this article will aim to help you understand how you can manage your period as a woman. The first thing we're going to be having a closer look at is hygiene. Your genital area should be washed away or should be washed using just water or mild unperfumed soaps. The area should not be washed externally as the inside is self-cleaning. If you do wash inside your vagina, you may develop an infection. And right now we're going to be having a look at sanitary products. There are various sanitary products you can use when having your period. The first one is sanitary pads, absorbent padding that you attach to your underwear. They come in many sizes and can be changed depending on how heavy your period is. They are easier to use than tampons. Many people use these when they first start their periods. Now let's focus on tampons. Tampons are tubes of cotton wool that you insert in your vagina to absorb the blood. They have a string at the end which you use to remove them. You should follow the instructions on the packaging about how to use them in, and it is important to change them every 4 to 8 hours. If the tampon is hurting you, it may not be in properly and you should remove it. Now let's focus on menstrual cups. Menstrual cups are small, flexible cups which are put inside your vagina and collect the blood. They are good because they can be washed and used again. This makes them a cheaper option long term, although purchasing the first one will be more expensive. Period problems. Period can be painful or heavy when there is a lot of blood. Irregular periods are also common during puberty and just before the menopause, when your periods start between the ages of 45 to 60. Other reasons for missing your period can be pregnancy, stress, sudden weight loss, or being under or overweight. If you are bleeding between periods, after sex or after the menopause, you should see the doctor. In the 2 weeks before your period, it is common to get mood swings, headaches, bloating, and breast tenderness. If these symptoms or parts of your body affect you severely, you should see a doctor. Overall, a period is a normal and safe part of life if managed correctly. And this article was by Shenghavi Loganathan on the Right for Education slot. And be sure to listen to Sky Alpha HD every Tuesdays and Thursdays. And we are going to meet again on Tuesday to see exactly which article we are going to be having a closer look at regarding the Right for Education.